Hey everyone, Dr. Charlie Johnson, physical therapist, and I want to talk about why back pain won't quit, meaning why is it that everything else in your body seems to go away when you injure it, right? You give yourself a paper cut, it goes away, you stub your toe, it goes away, but why won't your back pain go away? So this is a little bit of a longer video because it's a longer explanation, but here's the truth of it, okay? It's not always because you have some major problem with your back, all right? The quick answer is that the reason you feel pain is because pain is basically an output or an experience created by the brain, okay? So, no, it's not all in your head. This is an actual, issue that you're dealing with, but just understand that because it's an output from the brain, it can be magnified, all right? And sometimes it's kind of fooling with you, all right? So here's what we see. So here's a graph, here's pain, here's time. At any given point, you have 400 nerves in the body, 45 miles of nerves. They're just kind of waiting for you to alert them, right? So think of pain as your alarm system, right? And we all have a certain pain threshold. For some, they think it's high, it's low. It doesn't really matter. Just understand that all of us have that line, that pain threshold, okay? So now what happens when you injure yourself, all right? Well, let's just say you give yourself a paper cut or you hit your finger with a hammer. Well, what happens, it goes up, right, and it hits your pain threshold, and what do you say? You say, ouch, right? Now, do you say ouch forever? No, you don't say ouch forever, okay? It calms back down, and again, your alarm system sort of repeats itself, right? And there's not much of an experience around that, right? Maybe you do it quickly, and then you kind of move your fingers or, kind of swing your hand around, or maybe you, I don't know, you suck on your finger or something like that, okay, just to distract the system, right? So kind of like put some static in the back of, in the background, in the back of a TV or whatever, okay? All right, so it goes back down, right? So let me ask you this. Would it be unusual if you gave yourself a paper cut and you had pain for, I don't know, you had pain 3 years later? Well, the answer you're probably saying in your head was like, yeah, duh, of course, Charlie. Yeah, that would be weird, right? So you've already agreed that would be weird. Well, then the next question is what makes back pain any different, right? Yes, it's big, ugly, and scary because it's in your back, and because it's in your back, you can't see it physically versus like a paper cut you can see, right? But you already agreed that would be weird if being injured anywhere else in your body stuck around that long. So what keeps back pain lingering? So what happens, right, is you hurt your back, and it never quite calms back down. So you used to be able to do all this stuff before you felt back pain, okay? Now you're kind of here where you're struggling, and it's almost like sometimes maybe for you, if you're watching, it's tough to put your shoes on, or you've stopped doing the things that you love to do outside or with your family. So you have a lower kind of threshold for activity before you start to notice that you hit that pain threshold and you say, ouch. Now, why doesn't it go back down? What makes back pain different, all right? Your back has the same types of tissues, for the most part, that your body has almost anywhere else, all right? So what's going on is a couple things, right? So let's just assume that there is an issue within the tissues, we'll call it, okay? So that would explain it, right? So think of it like this. You would not think it may be so weird if you had a paper cut and it was there and it started to heal, you started to notice a scab coming, and then what happened is you cracked it. So then you bent your knuckle, and it started to bleed, and the whole process, you would imagine, would start all over again. Now just imagine every week when it starts to heal, you just keep cracking it and picking the scab, cracking it and picking the scab. Every hour you're picking the scab, right? Well, I think you would understand that would take longer to heal, right? Because you're constantly irritating the tissue and just not allowing it to heal, okay? So the same thing can happen. So this is one explanation for it, right? So one explanation for why back pain continues to bother you is that there's an issue in one of the tissues, meaning you continue to pick the scab somehow. So think about this. If you hurt yourself bending forward or lifting something or twisting or doing whatever you were doing, if you continue to put your spine in that type of position and you don't modify or unload it or remove the stress, you sort of don't put a Band-Aid on it temporarily, all right, what's going to happen is you're constantly going to be picking the scab. So again, if you hurt yourself bending over and you're bending over in a certain manner that put more stress at a certain part of your back, and you sort of pick the scab or herniated a disc, all right? Well, what happens is now, right after you did that, then you go and you sit on your way to work. And then you walk around, and maybe later that day you are outside bending over and picking things up. Then you go and you sit on the toilet, right? So you constantly are picking the scab such that the tissue is not allowing itself to heal. Okay, so that's one thing. But here's the issue, is that we could disprove that on many occasions as well. So what we know is that about 60% of people over the age of 50 have a herniated disc in their spine and feel no pain, right? So there's actually like evidence, or at least it looks like it, that there's a problem in the tissue. So in this case, the disc. But at the end of the day, these people have no pain. So you take 100 people off the street and you give them an MRI, 60 of those people who have no pain are going to have a problem. And that's part of the issue with these images, is that although they're, when somebody has pain, we go in and we look for a problem. That's just what they're doing. They're looking, they're magnifying everything. The herniated disc could have been there 20 years ago and you never knew about it, but it just so happened to show up as a problem with one of the tissues now, okay? So the issue is that if tissue always explained everything, then everybody with the tissue problem should have pain, but that's not true. We have many cases, just like I said, where people feel no pain and have horrendous, ugly, ugly-looking MRIs and terrible old backs, okay? So that's just not the case all the time, but it could be, all right? Now let me ask you this. So the experience is probably a bit different, right, when you hurt your back versus when you gave yourself a paper cut. When you gave yourself a paper cut, the pain lasted for 20 seconds, a minute, a day, whatever, and you wiggled it around, you sucked on it a few times, you put a paper paper towel and a Band-Aid, and that was it. You went on about your life, and maybe occasionally you would feel it, but that was pretty much it, right? So there wasn't a whole lot of an experience created around it. So remember I said pain is an experience created by the brain and or as an output from the brain to protect you from some perceived threat or danger, right? So having a paper cut is not nearly as threatening or as much of an experience as bending over picking something up, all right? Now, experience can change everything. So think about maybe the experience you had with your lower back pain. So perhaps what happened is, it was an important day for you. Let's just kind of tell two stories here, right? It was a big day. Maybe it was your daughter, your son's wedding, or it was your own wedding day, and you're picking up the boxes, ready to head to work, and you hurt your back, right? So what's the first thought? Well, besides like, oh crap, right? Is that like, oh my gosh, what am I going to do about my big day, right? So you have some type of heightened experience there, right? So the stakes are higher, so to speak, because now you got to figure out, what am I going to do about my back pain? And or maybe you were at work, right? And at work, you're at work to make money for yourself, for your family, for whoever. And it's important that you're able to do the job that you need to do, right? But you injure yourself. First thing that goes through your head is, what am I going to do? I have to work, right? Versus a paper cut, no big deal. You'll deal with that, right? So the context of when and how the injury occurs plays into this experience. And your brain is just sort of, your alarm system is more amplified at this point because it's a bigger deal, right? So then you have that experience and you go to see your family physician, and let's just say in this story, the family physician says, hey, like your back, it doesn't look good at all. This is probably what you did to it. You're probably going to have to see a spinal surgeon, or I want you to get take some medication, take these painkillers, and get an MRI immediately. Take it easy. Don't do anything. You don't want to hurt your back more. Well, what does that do? Now, you're kind of told by a doctor that you're in bad shape, right? And that things don't look good, all right? And now you need an MRI. Well, we already talked about the MRIs aren't that useful, but now the MRI, because they're going in there with a microscope, says that you have multiple levels of disc degeneration, spinal stenosis, and maybe some herniated discs. That could be the problem or could not be the problem. We talked about how a lot of people have that stuff and don't even know it, right? So how does that make you feel? Not good, okay? So the whole time you're your senses and the pain is heightened, right? And then you start to calm yourself down a little bit, but now the doctor starts to freak you out a little bit more. Now the MRI is more worrisome. How do you feel when you're told you have the back of an 80-year-old and you're 45 years old? Terrible, right? And then, not only that, so then you go have the MRI, and I don't know, now you can't sleep that night, right? So now you're freaked out because not only are you in pain, because there's an issue with the tissue, right? But you know, you're not sleeping well. When you're not sleeping well, then you're stressed out. When you're stressed out, like, how are you interacting with your family? Are you doing the things that you want to do, right? So now you're no longer exercising because they told you to rest, right? So just get this idea, right, and think back to a crazy experience you've had in your life, or maybe just one that sticks in your brain. Well, back pain becomes one of those things. It becomes some vacation. It becomes some major event in your life that's almost hard to let go of. Not that you don't want to. It's just so ingrained in what's going on that you think of it all the time, right? And it doesn't take much for those memories to flash back. So, you know, I think back to when I'm younger, and like when I smell something, it reminds me of, I don't know, maybe a memory like a campfire or something like that you know, I enjoyed when I was younger. In this case, though, you're just not enjoying it, okay? So the point is that there's this huge experience, there's this huge, like, pink elephant in the room, so to speak, that continues to keep this living on. And that's why back pain won't quit, okay? Even after the tissue has healed. Within the first 3 to 6 months, it makes sense that the tissue could be the issue. Now, even longer than that, if you continue to nick it and you're not modifying what you're doing, or you're not being told what to do properly by a healthcare professional who knows what they're doing, then yeah, this could be part of it. But usually there's a bigger picture to this, okay? Not to mention then you've got a heck of a lot of money as far as costs of the MRI, maybe lost time from work, and it goes on and on and on to create this more blown up experience, okay? So I think that's it for now. Just understand that there's a lot that goes into the treatment and the management of back pain. It's not just getting an MRI. It's not just getting an injection. It's not just having surgery. It's really looking at you as a person and the big picture of how we can get you back on track and get you back to the things that you love to do. And really, at the heart of it is education, okay? So sort of no pain, that type of no. So understand pain, and if you don't, it's going to be really difficult to get to where you want to go. Okay, so hopefully this helps you understand and kind of demystify some of the things you've been told. Back pain does heal, okay, and it has the potential to heal, and you have potential to get back to what you want to get back to in life. But there's a lot that goes into it, and you just need to find somebody who's willing to take the time to listen and understand that, okay? So if you found this video helpful, subscribe for more like videos, and start to feel and move better. Comment, like below, and or reach out to me directly at charliejohnsondpt@gmail.com.